So one thing that's important to understand is fibroids are not cancerous. They are called tumors, but they are well-defined tumors. They're made out of muscular tissue. Think about a boiled egg in a shell. And you know how you can if the shell was kind of cracked, longitudinal, and you just open up the egg, the shell, and you can scoop out a fibroid, scoop out the egg from the shell. That's really how a fibroid is. It is firm, it is solid, it is muscular. And within that fibroid, all the cells are the same. And fibroids can grow many different sizes, and they are classified according to where they are located. So you can see in this image that a pedunculated fibroid up at the top, on top of the uterus, is actually kind of like is hanging on a stalk on the outside. But sometimes that fibroid can come from the inside of the uterus and hang down through the cervix and actually into the vagina. There can be intracervical fibroids, which would be fibroids actually within the cervical area of the uterus, and it is the cavitary type of fibroid. So a fibroid sitting and hanging within from the lining of the uterine wall that can cause a lot of bleeding. And if there's shifts in in hormonal levels, some of these fibroids can degrade or start to shrink, causing lots of bleeding and also pain. So if a person is having your normal menstrual cycle with the uterine muscles contracting, the muscles literally are contract, you can see how a woman with a subserosal fibroid, which is on the kind of outside lining of the uterus, and the intramural fibroid within the full wall of the uterus can cause lots of pain when they're menstruating and having normal uterine contraction to empty out the uterus of its flow.